I understand now that the APP Plus quality score will apply to the MIPS-eligible providers in our ACO participating 10 practices. If we are an advanced APM ACO, then MIPS scoring does not apply?
Another great question, Janice. The answer is no. Again, you're likely to need a MIPS quality score for some of your providers, even if you're an advanced APM. The Medicare Shared Savings Program, the MSSP, like any other APM, can be a MIPS APM or an advanced APM. In the case of the MIPS APM, none of the participating providers will be a qualified participant, that is a QP. Everyone will be subject to a MIPS score and a MIPS adjustment. Participants in that MIPS APM are eligible to collect shared savings, and the MIPS adjustments will pile on top of that, adding to the gain or diminishing the gain, whether it's a positive adjustment or a negative adjustment. Now, if you're an advanced APM, none of your qualified participants, that is QPs, will be subject to MIPS. But there are likely to be providers in your ACO participating practices who are subject to MIPS. It hinges on the QP designation. There's a threshold measurement done by Medicare that each provider has to meet to be considered a qualified participant or QP. It's the percentage of the total unique Medicare patients you see that are ultimately attributed to the ACO that determines QP status. It's calculated and tracked by both count of patients and dollars of allowable charges. So it's percentage of your patients by count that you've seen that become attributed, or or a percentage of the dollars allowable charges billed, all your patients versus your attributed patients, that determines QP status. Hit either of the year-specific thresholds and you are a QP. Miss them and you're not. There is a partial QP designation that has a lower threshold, and partial QPs can decide to be included in MIPS or not. QPs don't have a choice. They're out of MIPS. Not those who don't hit either threshold are in MIPS. So those who have not hit one of the thresholds do need a MIPS score, or they'll get a negative adjustment in each performance year. In any individual practice in an advanced APM, MSSP, or otherwise, in any particular year, all providers could be a QP. Some providers may be QPs, or no providers may be QPs. No matter what your ACO contract looks like, MIPS APM or advanced APM, you always have to be alert for the MIPS eligible, or maybe we should express it as a MIPS liable provider. Your APP Plus submission might qualify you to collect all of your shared savings, but result in a negative MIPS adjustment for your MIPS liable providers. Now, you're more likely to be a QP if you're a primary care provider. They're going to have more patients attributed to them than most of your specialists. Your specialists, you're more likely to be a non-QP or a partial QP. A single specialty group that's in primary care, again, everyone might be QPs, and a multi-special group with a lot of specialists may have a mix. Your single specialty group may come out without anyone being a QP. So be aware of your MIPS liability when you're making your quality report for the ACO.